And we are live. Hope everyone is having a fabulous Friday here. What's cooking? Any questions, feel free and let me know. We're live here on YouTube, justinhealth.com/YouTube. Make sure you subscribe. Make sure you hit the bell so you get the notifications. So when I go live, you are on top of it. Hope everyone's doing great. Any questions, feel free and let me know. I got a few minutes for my next patient, so looking forward to diving in. What's cooking? Anything happening in the health world that you guys want to chat about? What is going on? Let me know. All right. So anything in the news health-wise, anything we can chat about? Let me think. Anything going on? Just trying to think here health-wise. What do you think? Any good topics? Do you think CBD oil is overrated? I think it depends what the reason you're using it for is. There's a couple of good benefits of CBD. There's one where it's, epilepsy, seizures. I think there's some great data on that where it can be really helpful. I think you should be combining it with the ketogenic diet first and then use the CBD second. I think number two, it can be used for anxiety and sleep, which can be very calming and relaxing. And there's typically no psychoactive properties in the CBD. So it's not like marijuana where you may feel high and such and may have like slower reaction time. You're not going to quite have that with CBD. And the other thing is some immune issues. It can have some benefits in immunobalancing. So it really just depends where you're at. Definitely with the seizure aspect, worth a try. Ketogenic diet first. Anxiety. I mean, I'm a bigger fan of adaptogens first, so try those first. But if you want to try it, I think it's okay. Just make sure you get a good source. There's definitely some issues on the sourcing, so you really want to make sure you're getting it from a good place. What do you like to raise IgA? Well, if it's overly low IgA, first thing is cut down the inflammation and get rid of the infections that are stressing out the immune system. Second, we can use probiotics, broad spectrum bifido and lactobacillus probiotics. We can always use Saccharomyces boulardii as well. And then things to help reduce the inflammation, ginger, L-glutamine, aloe, DGL, slippery elm, just things that are going to be very helpful for the gut lining. Genesis writes in, why do I consistently wake up between 3 to 4 a.m. every single night, burning up and having sulfur gas in gut activity? So not waking up because of hot flashes, just want to confirm. So not waking up because of hot flashes. Number two, if it's gas, I mean, there could be a bacterial overgrowth. There could be an infection, especially if it's that time of day. So I would think potentially infection as long as it's not hormonally related. Vivek writes in, what do you think about cortisol stimulation test, which oral ACTH solution is administered via a Dutch test you use? So in general, the ACTH stim test is used to pick up Addison's disease, right? Addison's disease is like almost adrenal failure. And instead of like just testing the adrenals where they're at, they're like, okay, we're going to stimulate. We're going to whip that tired horse and see if we can get that horse to move. And essentially, if they stimulate it and it's still really low, then they're kind of just like, all right, your adrenal glands have been beaten up, an autoimmune attack typically, and not making the cortisol it needs to make to function. So it's more ruling out a pathological state, Addison's disease, and not necessarily looking at a functional state, which could be just adrenal dysfunction, or the slang is adrenal fatigue, which dysfunction's better because you can be dysfunctioning in a high cortisol pattern, a low pattern. You can have a rhythm imbalance. So there's a lot of different ways it can dysfunction. Fatigue just kind of like highlights the fact that it only can go low, but it can go high, it can go low, and it can go everywhere in between. Any preference? Let's see here. Man, sorry about that, guys. I'm getting so many questions in. I can't even keep track of it all. All right. Any preference between Genova Diagnostic and doctor's data? Depends. Depends what we're testing here. I like doctor's data for the heavy metal testing. I like Genova a lot for the organic acid. So it totally depends. Any ideas with consistently below range liver enzyme labs? So we're talking like ALT, AST, like alanine and aspartate transferase, like what, below 10? I'd want to know about that. So in general, if it's consistently low, not sure. I'd have to look at some of my resources for that. It's typically, I'm never usually dealing with that. It's usually always on the higher side. Nicholas writes in, my mom had trouble with sleeping since going into menopause, especially waking up in the middle of the night. What do you recommend? Well, get the adrenals and get the female hormones looked at for sure. That's essential. And get on an herbal/bioidentical program to help support it, but also make sure the diet and the blood sugar and the nutrients are all in place. Neil writes in, Dr. J, I always value your advice. What do you think about choline supplementation? My muscles get tired quickly, so I thought I might try choline supplementation. Well, I think first thing is just make sure I appreciate the feedback, Neil, but make sure you're getting enough egg yolks. I'd say at least 4 a day is going to be great when you're doing eggs, but that's going to be a rich source of choline, organ meats, and then obviously good quality animal products. So I would try to maximize the animal products first because they're so nutrient dense from a choline source. Genesis writes in, let's see here. Cynthia writes in, what causes tongue sores? I like white blisters on the left edge of my tongue from the middle tip. Some burn and some disappear. Well, for me, when that happens to me, and I've seen it in a lot of my patients, that's usually a common sign of gluten sensitivity. So make sure you're not doing gluten, or if you're going out to a restaurant and you get gluten, you may see that as a side effect symptom. And Andre writes in, fasting versus nutritional ketosis, pros and cons. Well, here's the deal. And I've had conversations with lots of people on this. Nutritional ketosis is you're upregulating the physiology that would be happening if you were fasting or low calorie dieting, meaning you're really starting to burn up a whole bunch of fat. The difference is there's adequate nutrition coming in, protein, fats, high quality vegetables and antioxidants. So even though you're telling your body to go into a physiological state of breaking down fats, you're still getting adequate levels of nutrition. What's important, because what will happen is you'll go into this fat burning state when you're fasting, but if you're not in nutritional ketosis, your body will start to burn up a whole bunch of amino acids and protein. Now think about it. It makes sense, because if your body's not getting enough calories, which tissue is the most metabolically active? That's muscle. Okay. Like imagine this, right? Here are all your bills. Like, right, you have your cell phone bill. It's $150 a month. Let's say your cable bill and you have all the extra stations and the satellite stuff's at $300 a month, right? And your husband or your wife loses their job, right? What's the first thing you do when something happens to the income? You cut the most expensive bill. So what do you cut? Maybe you cut the cable bill and the satellites at $350 a month, right? What does your body do when there's low calories coming in? It cuts the most expensive bill. What's that? That's muscle. So the benefit of nutritional ketosis is you get this mimicking of the fasting physiology, but you get adequate levels of nutrition coming in. That's the big benefit that I see. Now, could you do a little bit of fasting here or there? Not a big deal. I'm just seeing people overdo things. People are consistently doing 6 and 7 day fasts and all this stuff. And there's some benefit by letting your gut break, rest and such. But let's face it, our ancestors that did those kind of fasts, they were kind of just chilling out all day, right? Once they had their kill and they had their food for the next month ready to go and they had their little place, they didn't have any much more stress beyond that. They weren't having to pay bills or, drive kids to and from soccer practice or all that stuff. Kids are a lot more of an asset back then, i.e. they just did a whole bunch of work for you. Today, they take a whole bunch more time and energy. So life is totally different this day and age. So I think fasting, if you're going to do it, try to choose a day or two where stress is down, you can hang out, you're not going to be dealing with the world as much like we do every day. Vivek writes in, beta-glucans are very good for low secretory IgA. Well, yeah, I mean, I'm a big fan of beta-glucans. So here's a reishi mushroom product that I use. And there's beta-glucans, 1,3 beta-glucans, an active immunoconstituent within the reishi mushrooms. There's also compounds in here called triterpenes, which actually deactivate viruses and support the immune system. So I'm a big fan of medicinal mushrooms to help improve immune function as well. Cheers to that. Aviel writes in, could I freeze green bananas and add them to my smoothie for resistant starch? Are the ones at the supermarket green enough for a good amount of RS? Yeah, I would do that. Basically, think of the green it's higher starch. As soon as it starts going more yellow and brown spotted, that means that starch is maturing into actual sugar. So totally, green bananas, resistant starch is fine. Irma writes in, what sort of diet and supplements are good to dissolve gallstones and avoid surgery? Already taking enzymes with ox bile and phosphatidylcholine. Great question. Hold on. I have a product here called Liver Supreme, and there's some good things in there that you're already taking some, but you have like milk thistle or silymarin, which tonifies and supports the liver. Phosphatidylcholine's also good. Taurine's great to help with bile flow and to help emulsify stones. Then you also have beetroot, which is excellent. And then you also have other things like dandelion and fringe tree root extract. These are excellent supports to help kind of thin out the bile salts, thin out the gallstones, kind of get them like, let's say, less jagged. So when the gallbladder contracts, you're not going to be basically petting a porcupine. And then outside of that, cut out some of the common food allergens. Pork's a big one too. Check out Dr. Jonathan Wright's article on gallbladder issues. Google Dr. Jonathan Wright, gallbladder issues. But Liver Supreme's a good product that I formulated for that. See here, Gabe writes in, about to start Parasite Cleanse with your line GI Clear 145. Great. So if you tend not to be sensitive and have no issues, just go at it. If you have a lot of gut issues, you tend to be more sensitive, add everything one at a time. Half dose on day one, day two, full dose, day three, half dose on the 4, continue the 1, full dose on day 4 of the 4 and the 1. And then day 5, same thing, half dose. And then the next day, full dose of everything. But taper it up like that. Add in the ginger tea as well, which will help with biofilms, and it will be a good anti-inflammatory, and it will keep everything kind of moving. Here, lots of questions coming in here, guys. Okay. You guys are just writing so many questions for me here. Hold on one second. Okay, I think I hit everything. A couple more things. Okay, good. Tea Time writes in, I have phlegm in my throat in the morning. I try not to eat before going to bed by a couple hours, but there's still gunk. Well, number one is I would look at really making sure the diet's 100% cleaned up. Cut all dairy out and go on a full paleo, if not paleo autoimmune template. See what happens. Start there first. Genesis writes in, not hot flashes, 20-year male problem, started recently, had methane SIBO and passed but resolved. Sulfur foods like broccoli and cabbage make symptoms worse, but not other FODMAPs. I would look deeper at the gut. There could be another infection that could be present. James writes in, happy Friday, Dr. J. Are you going to have a paleo-friendly birthday cake for Aiden's first birthday, or go all out with sugar and hydrogenated oil or cake? Great question. So we are going to be choosing a good bakery that will have like a cassava root. We'll do kind of a lower sugar thing. We'll do like some organic palm cane sugar, which is like a 15 on the glycemic index. So you can still get those taste buds going and have a lower glycemic index on the sugar side. We'll choose a safer starch. There's a couple of bakeries here in Austin and where we go that accommodate. So I appreciate you asking about that. And I think there's lots of good options. I think parents kind of go into the, well, number one, they say, well, you know, if I was a kid, what would I want? Right. So they kind of play into that. But number two, kids don't care. Like in the end, they just want that taste. And there's a lot of good substitutions that you can give your kids that will give them that same one. So like my kid's eating, he's like not even one, he's eating 5 or 6 ounces of meat at a meal. He's getting a half a pound a week. It's absolutely insane, but it's all good stuff. And you try to have the highest quality, but yeah, lots of good options there. Thanks for asking. Jane writes in, slightly low cortisol. What can you do with the diet? Well, it depends. If your height and weight's adequate, may want to add a little more carbs in. If it's not adequate, we may want to cut some of the carbs out. It just depends where your body's at. Number two is make sure that you are stabilizing your blood sugar. You're eating every 5 hours and you're getting enough calories. And then number three, we may want to look at doing some adaptogens, some glandulars, and or some bioidentical precursor hormones like PREG and DHEA. Heidi writes in, are you familiar with the skin condition hidradenitis suppurativa? It's hard to find a doctor who is. Yes, I am. That's an autoimmune condition. I've seen over a dozen people with it. An autoimmune template is a great starting point, but you have to work on the guts. You have to address that. But I've seen it many, many times. Autoimmune in nature. I know it can kind of leave, it can kind of be rough. It can leave these like really, really difficult and painful kind of boils on the abdomen area or in the growing area. I've seen that a lot. Jack MC writes in, can Pseudomonas aeruginosa cause stomach issue? Yes, it can. It's common cause of bacterial overgrowth, or it's a common bacteria involved in SIBO or bacterial overgrowth. Let's see here. Jane writes in, best diet for Hashimoto's, at least initially, starting out with an autoimmune paleo template is great. How do you know you don't have a gamma protein bacteria that produces arachidonic acid from choline, making choline a damaging bad thing instead of healing? Again, that's kind of getting in the weeds. It's a little bit more nuanced. A lot of choline is going to be in really healthy, good quality animal products. So, I mean, for me, most of the bacteria and most of the issues are going to come from refined processed carbohydrates. And then if you have SIBO, more on the FODMAP side. So you can always do an elimination diet, but that's typically not something I'm worried about. Any experience with the condition post-finasteride syndrome? Yeah, I mean, that's common with people doing finasteride drugs for like hair loss and such. I've seen a couple of people with that because it can really, the finasterides, from what I think is they're a 5-alpha reductase inhibitor. So they basically block the testosterone to going downstream to DHT. And the DHT is like that higher, stronger estrogen, and it can basically pinch off blood flow to the hair follicles and cause baldness, right? So it's trying to help reverse a lot of that. So sometimes it can drop the testosterone down and have some effects, but typically it's the side effect of the medication, and you have to work on fixing the hormones and fixing the gut and fixing the upstream body systems. That's really important. How can you heal erosive gastritis? Get to the root cause, get to the dietary stressors, work on the digestion, fix the infections. Aviel writes in, our farm raised muscles still good. I heard the Bivalve's farm are basically the same as the wild. Not sure. I think mussels and those kind of things are great, and they could be a great source of people that are vegetarian or vegan and are struggling to eat animal products. This could be a good one because they're not quite like an animal, but they still have a lot of the good nutrients that an animal product would have. So I think it's a great option. Vivek writes in, adrenal glandular extract, when does it help? For what stage? I mean, typically if cortisol is on the lower side, it can be very, very helpful. If cortisol is on the higher side, it may be too stimulating. So I think it depends on where you're at, but on the lower side, it can be good. The problem is people on the lower side just use it to bring it up, and they don't do things to get the HPA axis back on track. So using some glandulars, using some potential bioidenticals, using some adaptogens, using some nutrients. I think hitting everything up is really important. And the last thing is people that have chronic adrenal issues, they may not have gut stuff sometimes, and they may get lost and think that, oh, I just need to treat the adrenals, and they lose sight of the gut. But the gut can be a common source of inflammation and can drive a lot of adrenal issues. Peggy writes in, reduced NDT dose, half grain to 2 grains. So reduced, and so natural desiccated thyroid dose, half a grain to 2 grains over 8 weeks due to concentration of free T4 being at 1.5, but now free T3 and free T4 are in the lower end of the range. Should dose be increased to 2.5? So you're saying half a grain, so you increase the dose. So I guess I need to be a little bit more specific because you're going from a half to 2. Is that you're increasing it from a half to 2? That's a pretty big jump if you are. I need a little bit more data to give you specifics on that, but I would be going up in shorter increments than that, probably quarter to half grain increments. I'd make sure they're in divided doses, and I'd like to see your free T3 get to at least 3 or above. That'd be important. And then, adequate T4 to T3 conversion. Doc JC writes in, hey Doc, what is your current take on fish oils? Which omega products do you recommend? I mean, I think fish oils are fine. Just make sure you get them from a reputable company that is going to do the independent testing to make sure all the, the PCBs, the chemicals, the heavy metals are removed. I like a triglyceride form, just better absorbed. And just don't go crazy on them. When you take a whole bunch of polyunsaturated fats, there's something called lipid peroxidation, where basically the fats kind of rot or go bad, partly because polyunsaturated fats are more unstable, right? Poly means many. Unsaturated means the bonds are not double. Or the bonds, I'm sorry, are double bonds. So when you have more double bonds, that means, so in organic chemistry, a carbon can attach to 4 hydrogens. That's saturated. When the carbon has 4 hydrogens, that's saturated. And when it's unsaturated, it doesn't have the 4 hydrogens. It has a double bond in between. That double bond makes it unsaturated. Saturated means 4 hydrogen bonds. Unsaturated means it's less than 4, and there's typically a double bond between the carbons. That makes the fat more unstable and more likely oxidized. Hope that helps. So just be careful with it. Keep your fish oil to maybe 1 to 2 grams a day if you're going to do it. If you're doing it acutely, just be careful, make sure it's a good quality, and take in extra antioxidants to help with any of the effects of lipid peroxidation. Okay, here, guys. I got to jump off my call to a patient here. Let me answer a few more questions. What do you recommend regarding fermented foods? How often, cycle, or daily? Okay, here's a great question. So kombucha actually had a lawsuit. The GT Days kombucha burn had a lawsuit because they were sued because of a couple things. Number one, they were actually testing how much sugar and nutrients were in their drink after the fermentation process and not before it started. So the problem is they put more sugar in and there was less nutrition in when they started. So they got sued as a false labeling. Their whole perspective is, no. that sugar over the 30 days it ferments actually gets eaten up by the bacteria. A whole bunch of B vitamins and other nutrients get produced in that process. So they were actually looking at how much sugar and nutrients were in the kombucha at the end of 30 days and labeling that. But the FDA or the people on that side wanted them to do it before, so they got sued. And I get it. It's tough, right? What matters to me is I want to know what's actually in my kombucha when I'm actually drinking it. So the GT Dave's kombucha, you'll see a big increase in the amount of sugar in it, but it's not necessarily true. They're just having labeling issues where they have to label it before and not necessarily after. So on that note, I do like the GT Dave's. They are lower in sugar, 2 grams per serving, which is much better than a lot of other brands. Thanks, Nicholas. Appreciate you too. My hair's not falling out with keto. What's your experience with this? Will it stop? So where are you at? What's your height and weight? If it's starting to fall out, I would start to increase your carbohydrate 1 serving per day and see how you do. See what that threshold is when it stops. For leaky gut, besides the diet, is Saccharomyces boulardii? I think you mean, is Saccharomyces boulardii good? I think it is good. What's your thoughts on Phenibut? Any experience with the supplement? Is the same as GABA? Great question, James. So, I mean, there's some people that say it's very addictive. I've used it. I haven't had that sense, but it's a 2,3-phenobutyric acid. It kind of hits those GABA receptor sites, and it can have some really good relaxation type of effects. I just would say if you did it, just be very careful on the dosage. I think it can be helpful on the relaxation side. Because of the addictive tendencies, I tend to lean towards using GABA first. If you get the benefit from GABA, then I would try not to do it. But if you do it, just tread lightly. Kratosora writes in, is the DHEA bad once it's separated onto or into white clumps? I'm not sure what you're talking about. So DHEA, dihydroepiandrosterone, is a precursor sex hormone to estrogens or testosterones. And in my line, we have a DHEA drop that's liquid, and it's an alcohol base, so it gets absorbed sublingually. So you're typically not going to see it in a clumpy form at all. So I'm not sure what you're referring to there. Yeah, so tea time, I would definitely work on increasing your carbohydrates if you're that lean, 5'8", 115. I'd work on increasing the carbs. It could be an issue with insulin because you need insulin for thyroid conversion. And with your height and weight being that low, you're more on the ectomorph side. So I think you're probably just a little too low on the insulin, and that may be affecting your thyroid conversion. Again, this is things that people in the low carb community don't want to talk about. You get some people that actually do better with a little more carbs. They go keto and then they have all these symptoms and people are like, oh man, you're just not doing it right. It's like, well, no, it's like everyone's body type's a little bit different. Now, I think more people do better with keto than not because I think we're over consuming carbohydrates and people are more insulin resistant. So because of that, they do better. I do better more on a keto. So because of that, I think going keto is a better way to go. But for you, sounds like you got to adjust it, right? We don't want to be dogmatic about it. Think of recommending supplements and nutrition as literally it's a tool in your tool belt. I don't have any greater affection to my Phillips head screwdriver over my flathead. I just use the tool that is appropriate in the situation. Gabe writes in one of your videos, you mentioned that doing IF 1 or 2 meals a day wouldn't be a good idea for some because getting nutrients. What if I didn't a green smoothie and filled it with minerals and added nutrient powders? Yeah, if you're doing 2, it's easier with 2, but you really have to be on purpose. A lot of people, I had a conversation with a gentleman, a doctor recently. He said, no, but you can get all the nutrition from your fat cells. And I'm like, well, last time I checked in physiology textbook, I don't think your fat cells are a storage of vitamins and minerals and nutrients and antioxidants. I think it's a good dense source of fat and calories, but I don't think it's a good source of those things. So you still need to get those things into your diet. I don't know anywhere in the literature where your fat can actually store all of these nutrients. So I think if you did it in a smoothie and you get 2 a day and you were really on purpose about it, I think that's good. Hey, James, breakfast right now, honestly, is just going to be some bulletproof coffee, some grass-fed butter, and some collagen. And I'm probably going to have 1 or 2 pieces of bacon, pasture pork bacon, and then 2 egg yolks here in just a minute to kickstart my day. And then for lunch, I'm going to have a salad with some chicken and avocado in it. And then tonight, I may go on Instacart and order a nice ribeye steak and do it with some nice broccoli. I've been roasting my broccoli in avocado oil for 20 minutes at 400 degrees. And that's been making it kind of crispy and nice. So that's been a really treat for me. Thanks for asking. My insulin serum level 3.5. So yes, yeah, it's close to on the low side for sure. Play around with that. Yep. And then Nancy writes in, fat cells store toxins. It totally can. And that's one reason why some people that go ketogenic may feel like crap too. If that happens, you may want to just use some activated charcoal, may even want to do some glutathione or some sulfur amino acids to support the detoxification pathway. See here. Thank you. I appreciate that. Everyone is different. Yep, for sure. Especially if you know your body type and you already know your height and weights at a very lean level, then you just got to adjust it to what your needs are. Is colloidal silver good for you? Well, it depends. For knocking out infections, especially if you're trying to address a virus, absolutely. Most people go to the doctor when they're sick and they're given an antibiotic, and a lot of times the issue is a viral issue. Total waste, right? There's really no good antiviral in the medical community. I mean, there's like a cyclovir, like for like a herpes outbreak, but that's more topical, right? But you have Tamiflu, which shortens the symptoms of flu by 17 hours, but it also has a whole bunch of side effects of psychosis. That's not good either. So silver is a really good option when you are sick and there could be a potential viral issue. Hope that helps, guys. All right, I'm going to jump on to a patient here. Hope you have a phenomenal Friday. Give me a thumbs up. Give me a subscribe. Give me a share. Appreciate it. Subscribe to the Thyroid Reset Summit, thyroidresetsummit.com. We're pushing it back to January. My schedule is just too busy, but it's going live, and subscribe there to get some great updates. And you guys have a phenomenal Friday. Take care.